Hello, everyone. Welcome to another weekly wellness chat. We are so excited to be with you this evening. Today, we are discussing a very, very important topic. Today,
especially like given February is Heart Health Month, and we are so excited to be discussing about heart. So for those of you who are meeting us for the first time, I'm Dr. Shobha Rayapudi, and this is my husband, Dr. Arjun Rayapudi. We are both lifestyle medicine doctors. And every week, we actually do this weekly wellness chat where we share important and life-saving tips about like how we can prevent and reverse chronic conditions. And let's say even if we have them, how we can arrest and lead a healthy, happy life. So today we are excited that we are going to talk about our heart health. So, let us know where you're joining us from. So we always love to hear from you. So feel free to type in where you're joining us from.
Yes, and if you have any questions and comments, just share it in the questions and let your friends and family members know that this is happening. This is a very, very important topic. Like heart disease is the leading killer across the world for many people, and in Canada, it's like the number 2 leading cause of why many of our friends and family members actually pass away with. So this is not a this is a very life-saving topic.
So not sure if we are under the right window.
What do you mean?
So today,
yeah, we see that it is live.
Let us know if you guys are able to hear us.
Oh, it says, okay, Jacqueline says hello. Okay, now we can see. Okay, Connie says hello. Yeah, we know. Okay, we are with you.
Okay.
Yeah.
So in today's session, whether you get anything or not doesn't matter. All we want you to know is just 2 important things. If you get these 2 important things, we are all set. So one, like the foremost important thing is heart disease need not exist. And let's say, even if we have it, it need not progress. These 2 are the very important points, because most of us do not realize actually there are some populations in this world where there is no heart disease. Would you believe that? Like, as you can see, since heart diseases are number 2 killer, we might be thinking maybe that is so prevalent. But can you believe there are populations in this world where there is no heart disease? So that's why, like in today's talk, we want everyone to know that heart disease need not exist. It's a preventable disease. And even if we have one, we can arrest the progression of the heart disease.
Yeah, so Agneta is asking, how do you define heart disease? So the most common heart disease that we are talking about and we'll be addressing mostly is the coronary heart disease. Coronary heart disease is the disease of the blood vessels of the heart, where people develop plaques, and then the plaques eventually rupture from many of them and develop heart attacks or angina. So we're talking about coronary artery disease.
Yeah.
But there are other heart diseases as well, like there is a conduction abnormalities, like rhythm abnormalities, like the atrial fibrillation, and some diseases are seen in children, which are congenital heart diseases. But these are rare, like and also we want to focus on whichever is the major killer, and which is easily preventable. Like the thing is coronary artery disease, which is the mainly that happens within the blood vessels of the heart. This is totally preventable with the proper nutrition, and also you can not only even if you have it, you can reverse it. You can arrest the progression of it and maybe even reverse it and clean up your blood vessels.
So basically, you're saying uh, when we look at heart, you can see the conditions can exist because the blood supply is not going to the heart. So that might be one of the causes. Or when the rhythm in the heart it's not beating properly, if there are any abnormalities, so that might be the cause. Or sometimes the walls that we have in the heart, if there are any problems. So as you can see, there might be different reasons for diseases in the heart. But today what we are discussing is as most of you have heard, like heart attacks or ischemic heart disease, when there is not enough blood supply to the heart.
Mm-hmm. And Agrita, your question regarding foods and suggestions for atrial fibrillation, we'll come to that in a few moments. And if we don't come to it, just remind us after, because we will be covering some of the foods that are good for the for preventing and reversing heart disease, the coronary artery disease. These foods are also helpful for atrial fibrillation as well. So what causes heart disease, especially the blockage of the blood vessels of the heart? Any idea?
Yeah. So let us know, what do you think causes heart disease?
Yeah, like you might be hearing, has anyone here had any friends or family members who had heart attacks, had like either stents placed in the heart, or had to have any bypass surgery? Or even if your doctor told you that um, that you have high cholesterol, that means that is beginnings of the heart disease.
Yeah.
If you have diabetes.
Yeah. So some people are saying, okay, what causes heart disease? Cholesterol. Okay. So
high cholesterol. Yeah.
High cholesterol. Well, what else comes to your mind? What do you think causes heart disease? Bad food, no exercise. Okay. What else comes to your mind? What do you think causes heart disease? My husband.
My husband.
So simply you're saying maybe stress causes heart disease.
Yeah, stress can cause heart disease.
Yes.
Diet, being overweight,
or smoking, alcohol, highly processed food.
All these things contribute to heart disease, especially the type of disease that we're talking about is the coronary artery disease, which is like the blockage of the blood vessels. Madeline is saying genetics. So genetics do contribute a little bit, like genes may contribute a slight part, maybe about 5%, but 95% of this blood vessel blockage that is due to poor diet and lifestyle. Think of it this way: you may have bad genes, but it's your diet and lifestyle that pulls the trigger. Like if your genes for chronic disease are like the bullets, the diet and lifestyle is like the trigger. So just because you have the bad genes, unhealthy genes, or the genes that promote heart disease, you inherit them from the parents, doesn't mean you have to get the heart disease. Most of the time it's not just the genes that run in the family, it also the recipes that run in the family, it's the habits that run in the family. And sometimes nobody runs in the family, that's also a problem. So the more you walk, the more you're active, the more you move, that research shows that you have a less chance of having heart disease. But the most important factor that that is crucial for preventing and reversing heart disease is our food choices. And let us share our story. Like, this is not something that we came we learned in medical school, or we realized in our practice by itself. Like, so in while going through my medical school and surgery residency training, like residency training as a surgeon, I had to assist and perform procedures on the blood vessels that supply the various parts of the body. Some of the blood vessels that supply the brain, those are called carotid arteries. The blood vessels that supply the heart, those are called coronary arteries. And the blood vessels that supply the abdomen and the legs. Look, so in a vascular surgery rotation, like we were doing surgeries like almost every day, someone with blockages in blood vessels in different parts of the body. And let's say if someone had like uh,
A blockage
in the blood flow that goes to the limbs, to the legs, like what we would do is that we open those blood vessels, clean up those clogged arteries. And if that didn't work, we would do like bypasses after in a few months. And if that didn't work, like maybe even do like stenting of those blood vessels, like many. And if all of those didn't work, then the next option is to do an amputation of the limb. Like so, uh, this is used to be the routine, right? Like when we were going through our training, this used to be the routine. But one day, like this is after we finished our training, and I started working as a surgeon here in Buren. And there is so much heart disease in Newfoundland, like where we are. In Newfoundland, it's like number one place for heart disease across when compared to other provinces in Canada. And also number one, this is sad, like number one in terms of obesity, number one in terms of diabetes, number one in terms of colon cancer, breast cancer, stomach cancer, number one in terms of not moving much, number one also in terms of how much alcohol we take, like alcoholism. So all these habits and diseases are so prevalent in Newfoundland. And we didn't make the connection much, and we used to think it's the genetics. But one man who really opened our eyes was Dr. Esselstyn. We're going to share our screen to share some slides. Okay, you can see the screen. Just give a like or a thumbs up or love, or say it in the comments if you can see the screen. Okay, so this is Dr. Esselstyn, and he did like research for over 25 years on patients with heart disease. And we happened to see his work actually not in a medical journal, but in this documentary called Forks Over Knives. In this movie talks about the impact of food choices for our health, like on our health. And he shared a picture of an angiogram. Angiogram is a blood vessel of picture. It's a picture of the blood vessels of the heart. Here, what you see is narrowed blood vessel. It looks like the dog has been chewing on it. Very poor blood flow. And the same patient, within few months of changing his diet to a plant-based diet, there is more and more blood flow. So you could see the diameter of the blood vessel, the lumen of the blood vessel is like much bigger, and all this white color indicates the blood flow. This change happened without medications, without surgery, and without bypass, and without even statins. At that time, when he did this research, statins were not even that much prevalent at that time. Like now, many people are on statins, right?
Then how we can arrest?
Is it going on?
So, like, are they seeing the screen?
Yeah, Marlene gave a thumbs up. I think they are.
Okay.
Yeah. How are we doing? This is the thing. Okay, yeah, they can see the screen. Good. Excellent. Oh, is it okay? Let's see. Just 1 second. Okay. Good. Excellent. Now you can see, okay, here we see the comments. Like the more, this is like we are, talking on Zoom, but like we're relaying it on Facebook. So it's It's good. Excellent. Good. Good. Okay, so and this change with this reversal of heart disease, improvement in blood flow happened like within few months of changing to a plant-based eating. And we had this was a big revelation, and with this we actually changed. When we saw this, like we actually changed our lifestyle, right? Like we started adopting plant-based eating, and we saw that we had like more energy and like uh, more mental clarity, like more well-being overall. While this was happening, like my dad was diagnosed with heart disease. Like in March 2015, he had um he was having some shortness of breath and chest pain. And when he had an angiogram, it showed that he had 90% blockages in uh, three in two of the three main blood vessels that supply the heart. And one cardiologist said he needs to have stents, and another cardiologist said he needs to have bypass surgery. These are very risky procedures. Like if you were to have bypass surgery, like you have to have your chest cut open, take the blood vessels from the legs, and then you have to flip them and sew them onto the blood vessels of the heart. It's a very risky procedure. And I asked my dad, like, instead of having your chest cut open, why don't you open your mouth and put different plant-based foods? And he thought it was a crazy idea when his cardiologist was telling that he needs to have stents or bypass. But we asked him, why don't just try for a few weeks? And he decided to give it a try for just 2 weeks. In those 2 weeks, he was walking longer distances with no shortness of breath. And in 3 months, he came off of his blood pressure medications, diabetes medications, and cholesterol medications. And 6 months fast forward, like um, had he underwent like another heart treadmill stress test where he could just finish that in with no problem, and he never had to have any stents or bypass surgery. So that was our we saw how powerful it is, that how well our body heals within just a few weeks to months when we switch to a plant-based diet. And this is something that we have seen in many of our Gift of Health participants as well, like people coming with high cholesterol, high blood pressure, heart disease, diabetes, just improving their health within few weeks to months, switching to a plant-based eating. Hi, Pearl, how are you? So let us ask you, like, when do you think the heart disease starts? What age do you think the heart disease starts? You can take a guess, like, does it start at like 20 years, 30 years, 40 years, 50 years? You might have been hearing more and more heart disease in people who are like 13-year-old, 30-year-old, 40-year-olds, like many people getting heart attacks. Believe it or not, like heart disease actually starts very, very young.
Okay, Marlene says
15, Geraldine says 50, 25. Okay. This is a poster that was made by Physicians Committee for Responsible Medicine. And even Dr. Esselstein's work, he points out that heart disease starts as early as 10. by 10-year-old, with many of our like children right now who are overweight and obese. And in fact, some of the research study shows that 1 in 5 teens are actually have high cholesterol as well. So in some studies, it shows that atherosclerosis, which is hardening of the arteries and high blood pressure, can begin as early as age 5. As early as age 5. So if someone has heart disease at age 30 or 40, it's not something that happened just like that. It is something that happened over decades.
And it's better to, because I know this slide has many interesting facts. So like we might, since it's a busy slide. So as you can see, when it comes to kids, like how prevalent, even like formation of plaques or high blood pressure can begin manifesting by age 5. And here I know, like Gail is saying, heart disease for me started at 52 years old, 5 months ago, with a 99% blockage in my artery. That's an excellent point you brought up, Gail. So this is something we think that happens in adult, but like, when does the plaque formation start is the question. So we will actually go more in detail for that. But while we are in this slide, so if you see, like, according to the study that they did, like most of our children, when you look at the diets of most of the children, 3 in 4 children consume excess saturated fat. 9 in 10 eat too much sodium, and just 2 in 10 kids eat healthy, who eat 5 daily servings of fruits and vegetables. So as you can see, given this status of our diet, it's so easy to see heart disease much, much earlier.
See, many of us think that when my heart disease started, or like someone's heart disease started, like when they were diagnosed, but that's when it started causing symptoms. Mm-hmm. But think of it like a tip of an iceberg, like the iceberg, that there is the tip, the small tip, and there is so much of the iceberg is under the water. By the time you're diagnosed, there's a lot of damage has happened. So the disease actually started long time ago. We're saying like 10, 20, 30 years of constant damage to the inner lining of the blood vessels. Like what happens is, this is how the normal blood vessel looks like, the inside of the normal blood vessels, like if you do a cross section of it. With eating like the high fat foods, the cheesy foods, things like pizzas, burgers, or fried foods, oily foods, and meats, which have a lot of saturated fat, you start to form more and more plaque, because there's more cholesterol, especially the bad cholesterol, the LDL cholesterol, and the blood becomes more thick and sticky. Or the sticky LDL cholesterol, it gets under the lining of the blood vessel. It damages the inner lining of the blood vessel. It's called endothelium. And gradually there is more and more and more deposition of the plaque. This is the another view of the same blood vessels. What happens is, like, there is the cholesterol and the inflammation is happening under the blood vessel wall. So the blood vessel tries to contain it with a cap. Like this is all the fibrous tissue trying to seal off the inflammation. But what happens is, with the ongoing inflammation underneath the blood vessel lining, the cap becomes more and more thin. And with just sheer force of the blood flow, this plaque, this cap, the cap gets thinned out and gets ruptured. And once the cap gets ruptured, all the inflammatory substances and the cholesterol, it gets into the bloodstream, and that causes a cascade of clotting. And when you have a blood clot on top of a ruptured plaque, that's when the blood supply to the heart muscle is cut off. And that's when you experience like this chest pain, and that's what we call heart attack. Crushing chest pain, like sudden crushing chest pain. It's just as if like an elephant is sitting on you and it doesn't go away. It's very dangerous. Like some people are lucky, they get chest pain that comes and goes, which is maybe like warning sign. But in 1/3 of the people, the first symptom is actually death. So it's very unfortunate, and it is at the same time, it is a preventable condition. Like this is something that can be prevented if we just fix like one thing, that is mainly the nutrition. So let's before we go to what to eat and what to avoid, we want to share with you what is a typical management that is being followed for someone who had plaques. Like this is a cross section of the blood vessel. This is someone who has a plaque. And if the current treatment, standard of treatment, is somebody has plaques in the blood vessels, is to have angioplasty. Angioplasty means you pass a a metal wire, and on top of that, there is an expandable stent, which is a support, which will stretch the area where there are plaques, and it opens up some of the lumen of the blood vessels and compresses the plaque. It improves the blood flow.
So, with all this management, if you see, like, are we addressing the cause of the disease? Like
Yeah,
here,
that's the big question, right?
yeah.
Like,
So here, of course, we are trying to open the blood vessels that are clogged or that have been narrowed. But are we addressing the cause of the disease? So let's say even if we place stents or do bypass surgery, can we prevent heart disease?
have you heard of anyone who had stents in the before, or who had bypass surgery before, ended up having heart attack, or ended up needing more stents and more bypass surgeries? Why is that? Because when we do this stenting or do the bypass surgery, are we addressing the cause of the problem? What caused the plaque in the first place? It's the food and lifestyle, right? Yes, Marlene says diet, it's a food and lifestyle. So having stents or bypass surgery without fixing the food and lifestyle is like a band-aid. Imagine this, like if you have a leaky tap or leaky faucet, and you see that in your kitchen, like there is a lot of water on the floor, will you keep mopping up the floor, or you'll just turn off the leaky faucet or the leaky tap? So going for like stents or bypass surgery without addressing the cause of the problem is just like a band-aid approach. Yes, there is a role for stents or bypass surgery in a small number of patients. Like if someone is having an acute heart attack and they present to the hospital like within 90 minutes, then there is a role for doing an emergency procedure on the heart. Or if someone has like a severe disease of the main blood vessel, like we call it as the left anterior descending, or the LAD, if that is involved, then there is a role for having a bypass surgery. But otherwise, like for majority of the people who undergo stents and bypass surgery, it's uh, research is showing that there are other options, there are better options. Like this is one route where, like most of the modern conventional cardiology, this is how we are managing it, which is there is more morbidity, there is more mortality, there are more complications with this, because stents and bypass surgery, there are risks with it. Whereas when you switch your diet and lifestyle, like this is a patient that we shared earlier, like where he just changed his diet to a plant-based diet, whole food plant-based way of eating, that improved the blood flow within few months. And we could see that the blood flow improving to the muscles of the heart as little as just, can you guess like how many days does it take for the blood flow to improve? So like here, what you're seeing on the top is the heart muscles, and the red color is the blood, the amount of blood flow. And you can see compared to the above, the bottom one, there is more blood flow. And this change, it took just 3 weeks. Just 3 weeks of plant-based eating is showing to improve blood flow on the heart muscle scans. And this is without stents, without bypass surgery. So Geraldine is asking, how can you avoid taking blood thinners with your diet? The thing is, Geraldine, can you be more specific? Like, so the blood thinners are typically recommended for someone where there is a concern for increased clotting. So if someone has the risk of getting more clots, those are the people where the taking blood thinners is recommended. But um, I'm not sure we understand your question. It says, how can you avoid taking blood thinners with your diet? So we'll come back to it, see if you could be more specific. So how long do you think it will take for your blood to change after you eat, right? Can you guess? The moment you eat the food, your blood actually changes. The nature of your blood changes within 30 to 60 minutes. There is a researcher called Dr. Robert Vogel. He actually did a research, like he fed patients with a meal of oatmeal and fruits, and then the next meal was like vegetables and like some grains. There was a second group where they were fed meals of eggs and cheese and butter and burger, like a hamburger. When they compared the blood, the quality of the blood compared to the first group, the second group, the second group who had the meat and a lot of fat in their diet, their blood was so sticky and thick. Whereas the people who were on they were given a meal of oatmeal and fruits, their blood was nice and thin. And that change in the blood happened within just 30 to 60 minutes. And that lasted for almost like 6 hours. So what we are saying is very, very powerful. Like you have the ability to change the quality of your blood within few minutes. Isn't it powerful that you have such a good choice? Like, we can choose how your blood want to be all day long. Jacqueline says Yahoo. So imagine this, like if somebody is eating eggs and bacon for breakfast, or like a lot of sugary cereals, and the regular cow's milk for for breakfast. Lunches, typical lunches for many people in Newfoundland could be like a turkey sandwich or a ham sandwich, or some, like if we go to a cafeteria, sometimes they serve like fried chicken with some fries, and then suppers could be shake and bake chicken or pork chops. So if you are eating these kind of typical, if you eat typical Newfoundland meals or typical Canadian or American meals, you'll get the typical Newfoundland diseases or the typical Western diseases. So these are the thing is, as we just shared, when you eat this kind of foods, your blood is changing within few minutes, and that effect on the blood vessels is lasting up to 6 hours. So if you eat these damaging foods, like the foods that damage your blood vessels for breakfast, the damaging effect lasts like almost up to 6 hours. Before your blood vessels recover, you have a meal of some fries or fried chicken or pizza, and then that's another 6 hours of like damage before your blood vessels have a chance to recover. You have another meal in the like supper meal with some shake and bake chicken or pork chops. Do you see that like your blood vessels didn't have a time to recover? And if eggs and cheese and butter or chicken or meats are a part of your diet on a daily basis, you are damaging your blood vessels on a daily basis. Does it make sense? So if someone has heart disease, that they developed by age 30 or 40 or 50, it is not something that just started then. It is something that started at least 10, 20, 30 years ago. That's what the research is showing. Does it make sense? Yes, good. So what foods to avoid? So that's what we've been talking about, right? Like what foods to avoid are the oils, the meats, the chicken, fish, dairy products like cheese, butter, like sour cream, milk, cow's milk, and the ultra processed foods, like even the plant-based foods, if they're ultra processed, you want to avoid them. Why? You may ask why. Like oils, like many people think that the oils are healthy, especially like olive oil is healthy. Thing is, oils are one of the most inflammatory substances to the blood vessel lining. That includes like olive oil. There is quite a bit of research on it, and also oils are what these are just like junk food. Like uh, for to make a spoon of olive oil, you have to squeeze about 36 to 100%. I'm sorry, 36 to I saw 36 to 40 olives. You have to squeeze them to get just a tablespoon of olive oil, right? And this tablespoon of olive oil has 120 calories. Do you know how much you have to run to burn that 120 calories? It's like a kilometer and a half. And along with that, like oils, like the meats, these are high in saturated fat. Um, Hope is asking, can someone put in the chat the researcher who discovered
Vogel.
the Dr. Robert Vogel? It's a Vogel. We'll type it in, yeah. Dr. Robert Vogel. So, so meats are so pro-inflammatory uh, because the saturated fat, the like the amount of animal protein, the animal protein itself is so inflammatory, and the bacteria uh, that comes along with the meat, they promote the formation of endotoxins in the blood. And also recently researchers discovered that there is a substance, a toxic substance called TMAO. It means trimethyl amino oxide. That is also another substance that is being produced more in our tissues when we eat meats. That includes chicken and fish. Chicken and fish, they're not a whole lot different from the red meat. Red meat or white meat, like any meat, is like muscle. And these muscles have saturated fat, they have cholesterol, and they have animal protein. Like research shows that fish is a little less harmful than the chicken. Just because something is less harmful doesn't mean it's healthy. It's like a smoking a filtered cigarette versus cigarette. Research actually shows, like if you compare people who eat meat based diet versus a fish based diet, it is actually a little bit better. But if you compare people who, if you look at the populations where they were eating plenty of fish, there was still quite a bit of heart disease. There was still dementia in those populations, diabetes in those populations, and overweight and obesity. But you compare these populations to people who are eating a predominantly plant-based diet, it's like there is heart disease is non-existent. So fish is less harmful than the red meat, but still, if you have to choose between a meal of like beans and lentils with whole grains and vegetables versus fish, the whole grains, beans, and lentils is much more healthier than the fish. So, okay, Geraldine is saying atrial fibrillation, they say you should take blood thinners, but if you are not happy with that, can you avoid it by doing it plant-based? Geraldine, there is no research. There is no research on it for people with atrial fibrillation. I haven't come across any research where you could just do plant-based eating. If we come across, we'll let you know. But as of right now, if someone has atrial fibrillation and if the arrhythmia is the abnormal heart rhythm is there, then it is better to be on a blood thinner. And the thing is, there are newer blood thinners in the market which are not the side effects are less and also easy to monitor as well. So you can talk to your doctor about like what choice of blood thinners you can be on. And but if you come across any studies that I don't have you come across any?
The thing is here, when it comes to treatment of atrial fibrillation, But does plant-based diet help to heal? So it's not that plant-based diet cannot do anything, but it's always better to choose plant-based versus eating foods that are causing inflammation and causing plaques in your body. So it's better to go for plant-based diet.
When it comes to blood thinners, with people with atrial fibrillation,
It's better to continue to use your blood thinners.
Yeah, until we have like new evidence where just a plant-based eating, we haven't come across that evidence, but um, still, like eating plant-based will help the decrease the risk of strokes. Like one of the complication, like why people with the atrial fibrillation, they're put on these blood thinners, is because with atrial fibrillation you have a higher risk of developing strokes. And research shows that when people eat plant-based, there is a, for every 10 grams of fiber you increase in your diet on a daily basis, you cut down the risk of stroke by 7%. So plant-based eating can help you in many ways to prevent stroke and to keep your heart strong, even when you have atrial fibrillation. So I think we covered this one, like why animal-based foods are inflammatory. They are pro-inflammatory, they're high in saturated fat, they're high in cholesterol, they're high in calorie density, so they promote obesity. There is not much fiber, not much phytochemicals and antioxidants. These are the substances that decrease inflammation. And apart from like many other conditions, like the animal-based foods also have been shown to increase the blood pressure, promote the risk of heart disease, and they also promote diabetes as well. And this is a deadly combination. Like if somebody has diabetes, do you know, if you have diabetes, your risk of getting heart disease goes up by 4 times. If you have diabetes and high blood pressure, your risk of getting heart disease goes by 12 times. If you have diabetes, heart disease, high cholesterol.
If you have diabetes,
I'm sorry, yeah, if you have diabetes, high blood pressure, and high cholesterol, your risk of getting heart disease goes by 20 times. So this is not a, this is a like a ticking time bomb. If you have diabetes, high blood pressure, high cholesterol, and you're overweight, it's like a ticking time bomb. Like the heart attack or heart disease is just around the diagnosis is just around the corner. So it's very important to understand what you can eat and start changing your diet. So people ask, okay, what can I eat if I can't eat all these foods, the meats? As Dr. Assistant says, don't eat anything that comes from something that has a face or a mother. If you are left out all the animal-based foods, you don't have to eat rabbit food. You don't have to eat cardboard. You can eat a lot of plant-based foods, like you have whole grains, you have beans, fruits, vegetables, nuts, and seeds. Don't worry, you don't have to eat them just like that. You could. I
see parsimon in there.
Yeah. Shobha is always thinking about parsimon. That's a favorite fruit. So you can mix and match these things and make the foods that you like. Like you can make stews, and this is a hearty vegetable stew. This is a bean barley soup. You can make cakes. You can make pizza. You can make burgers and fries. All these are made with plant-based ingredients. You can make fries and pasta, lasagna. You don't have to miss any of your favorite foods. And we can show you even more options, like, what can you make? How many of you have visited Giftofhealth.org? Let's take you to Gift of Health, and there are so many choices that you have, like different breakfasts that you want to make, lunches and suppers, because the biggest question that once you start contemplating on how to transition to a plant-based eating, you want to know what can you eat and like what can you make, right?
So are you guys able to see the screen?
Okay, okay.
It closed. Then
yeah, they're able to see the screen. Okay, yes. Okay, so would you like to know, like, what are the things that you can prepare for preventing and reversing heart disease, or even other chronic conditions, like if you have diabetes or high blood pressure or high cholesterol? Good. So all you have to do is go to Giftofhealth.org. You can click on, do you see this button here, recipes? You click on recipes and you get this grid. So here we have different appetizers, different breakfasts, desserts, like dips and sauces. There are Indian recipes, kid friendly, lunches and dinners. There are Newfoundland recipes. There are salads and dressings. So one thing people struggle with when they eliminate oil from their diet is, hey, how can I make healthy salads and dressings? You can check this here. um, if you click here, the breakfast, the grid changes. So here we have various recipes. Like it's not just the Newfoundland recipes. Like, but if you just want like local Newfoundland recipes, you click on this NL recipes. So you'll see the NL recipes here. Like these are the recipes that are tried and tested by our friends here in Newfoundland. Several of the Gift of Health family members, they have made these things. Like you can make meatballs marinara, you can make different wraps, um, different types of salads, nice potatoes, like soups and stews. This is Connie says, I'm almost 3 years eating plant-based whole foods and I don't miss anything. Wonderful, Connie. Excellent. So there are, you can make burgers, and if you like chocolate, for every now and then you can make chocolate date nut rolls. There is oatmeal. Southwestern bowl is so popular. This is something that it's one of our favorites. If you want to try hot dogs, you can make carrot hot dogs. Healthy ones, like these are the foods that you can enjoy without feeling guilty about it. Like this chickpea salad. Chickpea salad is so delicious. Like many people have tried and they said it tastes even better than the chicken salad. And this stew is made by our friend Jeff Moulton. He created like a delicious recipe there. Black bean brownies. These are another popular one. This is a very, very popular dressing, like 3-to-1 dressing. So you have so many choices, like what to make for breakfast, lunches, and suppers. You just browse and like decide, pick 3 breakfasts that you want to try, 3 lunches that you want to try, and 3 suppers that you want to try. If you are looking for Indian cuisine, so you can click on the Indian recipes, and here, like these are the foods that we grew up with, like samosas, like vadas. Upma is like a stir fry with vegetables. This dal is a cucumber lentil stew. Like many Newfoundland family members, they made this one. Yeah. This butter tofu is a great replacement for butter chicken. It's so easy to make. This puffed wheat savory snack, like most people, I see a question like, are there foods you can recommend to enhance collagen production? Um, so if I am not familiar with any particular research that is done specifically to enhance collagen production, but let's just see. Like sometimes, like Dr. Greger might have had something, like he surprises us. Just give us a minute. Nutritionfacts.org. Collagen production. So, Hope, when you're asking about collagen production, like, you're probably wondering about how to decrease inflammation of the joints. Is that a decent assumption? You can let us know, because if the issue is um, osteoarthritis, then the plant-based diet can help decrease the inflammation. Okay, so we just did a search to see if anything we are able to find anything for a
Joints,
yeah
anti-aging.
yeah. If
So when
we,
you
we just
said
did a search, like a quick search, if we could come up with um, any studies on plant-based foods enhancing collagen production, we didn't find any. But if your concern is about joint health and anti-aging, then you don't have to look anywhere else other than eating more fruits, like different colors of fruits, rainbow colors of vegetables. uh, the more colorful the fruits and the vegetables are, the more antioxidants in it, the more phytochemicals in it. The more antioxidants and phytochemicals that are in the foods, they decrease your inflammation. That is anti-aging. Aging is inflammation. The more inflammation is happening in the body, the more aging. Other thing is, the more hydration you do, that also improves, like slows down aging. And the foods, that the fruits and vegetables, these are 80 to 90% water. And the water that you take in from fruits and vegetables, your body retains them twice, like 2 times more than the water that you drink. Other thing that you'll notice is the aging also has to do with your outlook, the smile that you have, and the rate, uh, how your skin is. What we observed is that people who this is like based on science, like people who are eating at least 3 to 5 servings of fruits and 5 to 7 servings of vegetables a day, they are more happier and healthier. The more happier you are, the less you age. So more fruits, more vegetables, more greens, like green leafy vegetables, they decrease inflammation. And when it comes to joints, if this is for applicable to everyone, not just one person, like if you have excess weight, that excess weight, it ages the joints quicker. So I was a principal during global pandemic. Yeah, that's very stressful. Oh man, we feel for you. Yeah. So doing meditation, like our jobs are like, so we do so much activity from morning to evening in the hospital, like at home, and teaching online. And we also have family responsibilities. We have a son, uh, and we have, like, pets. So we are busy at home, busy at like the work, and busy also with this not for profit that we have. So we're doing so much activity. uh, but how, like, one thing that helps us to keep us grounded is definitely the plant-based eating, but also the breathing exercises that we do, the yoga and the regular exercise. Either we are either doing walking or jogging or doing some body weight exercises. This is also very important, like when you want to prevent and reverse heart disease, these things complement each other. One is choosing plant-based eating. The other aspect is moving more, increasing the activity, and then stressing less. Stressing less. It's easy to say, but it is doable. Like with some.
And that can be learned too. That is a skill that can be learned, how we can manage our stress. So Donna is asking, okay, you're saying to eat more fruits to reduce inflammation, arthritis, But if I eat more fruits, I'm type 2 diabetic. So any particular fruits I should be eating or avoiding?
First, you want to understand, Donna, like what is type 2 diabetes? So type 2 diabetes is a condition where the body is making insulin, but the insulin is not able to do its job. That condition is called insulin resistance. So as long as there is insulin resistance in the body, when you eat like the foods that cause insulin resistance, your blood sugar goes up. The foods that cause insulin resistance are actually the meats. It's the cheese, the butter, the chicken, turkey, beef, pork. The more meat you eat, the more insulin resistance. The insulin resistance means, once again, there is bodies making insulin, but it is not able to do its job. Now, where does this whole fruit confusion, fruit dilemma come from? See, the thing is, our body, our cells run on glucose. We all need glucose to function. But the glucose cannot enter into the cells by itself. Glucose needs insulin for it to enter into the cells. Think of it this way. Insulin is like the key, and the glucose, like insulin has to open the key into the, to open the door for the glucose to enter into the cells. And only when there is glucose in the cells, you have the energy to think and do any activities, play or move. But if the insulin, where the insulin key attaches, if that is clogged, then insulin cannot do its job. And what clogs up that insulin key is actually the excess fat. The excess fat inside the cell and outside the cell, it clogs up the insulin. So insulin cannot do its job. Now, as you change your diet to more whole grains, more beans and lentils, more vegetables, more fruits, then your insulin resistance, your body's insulin resistance, it improves. As the insulin resistance improves, your ability to tolerate, your ability to take in more fruit, it improves. So in the beginning, we say if you're a type 2 diabetic, the most important food group you want to focus on is actually beans and lentils and whole grains. That when it comes to whole grains, making sure those are intact whole grains, not things like breads or flour based, but going things like with like quinoa or brown rice or millets or steel cut oats, like where the grains are less processed. When it comes to beans, going for chickpeas or black beans, red beans, kidney beans, navy beans, any kinds of beans, lentils, red lentils, yellow lentils, brown, green lentils. These are the most important foods. These foods will heal your body so fast, and they keep you full for longer as well. And enjoy different kinds of vegetables. And the initial fruits that we highly recommend are going with fruits like berries, strawberries, blueberries, blackberries, raspberries, and low glycemic fruits like going things like papaya or like different kinds of melons. These are fine. And the high glycemic fruits are bananas, grapes, pineapple, and mango. These 4 fruits, they might shoot up your blood sugar a little higher compared to the other fruits. So these ones, you can have them, but not too much in the beginning. But as your insulin resistance improves, you can enjoy more and more of these foods. We're going to stop about answering. I hope that's helpful. Like, okay, Donna says, wow, that's very interesting. So hope you found that helpful. But next week, right? Mm-hmm. Next week, do we have Brenda?
Yes.
Yeah. Brenda. So next week, you really don't want to miss the next week live, because we do have Brenda Davis. She is she's the author of many books, I think 10 or 15 books. Mm-hmm. Brenda, she has written books on reversing diabetes with a plant-based diet. She's a dietitian, and she is a mother and a grandmother who's almost 65, I think. And she is in top shape, like, fitness wise, it's just amazing, so inspiring, like, but she's a dietitian. She's a registered dietitian and author of many books. And she has she has written excellent articles on reversing diabetes with food. So yeah, Brenda Davis, you can look her up. She is our guest, like in the next week. So you don't want to miss that. Let your friends know, family members know, and you can join us for the next week Gift of Health Wellness Chat, and you can learn, keep learning more. Meanwhile, start like acting on this information and start plantifying, start modifying like your breakfast, lunches, and suppers.
Okay,
Sound
so
good?
Geraldine is asking, is spelt flour a better choice?
It's a little bit like
compared to what? So again, here, what are you comparing against? That's also a main question.
Mhm. So if you compare spelt flour with a processed, enriched, bleached white flour, it is better. But if you compare spelt flour with either quinoa or steel cut oats, quinoa or steel cut oats or millets or barley, they are much more better because those are whole grains that are intact. Remember this, like when you make a flour out of something, even if it is whole wheat flour, it is flour.
So Geraldine question was, is it better compared to white flour? Definitely.
Yes, it is better. But if you, it's like a smoking a filtered cigarette versus a cigarette. So smoking a filtered cigarette is a little bit better. So, but instead of, I know we're not saying avoid the spelt flour completely, but uh, minimize the intake of foods that have flour in it. Rather, choose the foods that are more whole and more intact. Does it make sense?
Okay, so yeah, so we have gone over the time. As we said, don't miss next week, because we really have an exciting session with Brenda Davis, and we hope to see you next week. Have a wonderful evening and stay heart healthy.
Yes. Bye bye, everyone.
Bye bye.